Oh, baby. Let me know if the light's okay.
Yeah,
I need to move it all.
the light is good. It's crazy.
Holy moly. Whoa.
I try to do some foam rolling, but, just ain't the same.
Correct. And roll credits.
Yep.
The upper area too, right when you went like this, right here. I know, just like it hasn't moved in forever.
That's good.
Yes.
Oh, that was it. Wow, that hasn't moved. Good.
Oh.
All right. You did great. Just kind of look gently up for me again. Wow. Whoa. Yeah.
Oh, it doesn't, I don't have that pain anymore.
Isn't that cool?
Yes.
Thanks for coming in, Jesse. Tell me about yourself. I know you have had some imaging taken and you're dealing with some lower back, and I noticed on your pain diagram kind of indicated a lot of different regions.
Yes.
Give me an idea what's going on.
Okay, so this goes way back to October of last year. I'd worked out for 5 months to run a race, ran the race, and then like an idiot, I decided that I was going to work out 2 days after, not take a break. I never really took a break when I was training for the race either. So the first injury occurred on pull-up bars, and what it felt like, that was on a Monday, it felt like my neck and upper back popped. That's the best way I can describe it. And like an idiot, the next day I decided I'm going to just go ahead and work out again. So I worked out again, running, kettlebelling, calisthenics, the whole 9 yards, and my upper back was actually not feeling too bad, but I got on the pull-up bars again, and this time I decided to do some leg raises, and something happened. I felt a pop
In the lower back.
on the lower back. So 2 days in a row, I got injured, and then after a couple days, because that was while I was in the field working, a couple days later, things started to feel a little better in the low back, because I've had low back problems on the right side for a long time. And then lo and behold, I'm going to do some yard work, and then that just killed me. I mean, it about put me on the floor.
What position for your neck, what position were you in, if you can recall, were you in when you felt it pop? Were you bent forward? Were you?
I was up right about chin level with a pull-up bar. Right about there is where I felt.
And you felt it in the lower neck, kind of. Make a pop.
It felt kind of like the lower neck, or possibly
Upper
between
back.
the shoulder blades.
kind of. When you're pulling like this towards yourself.
Yeah, but I didn't know if it was referred anyway. So that's when I got down. I'm like, oh man, what's going on? Yep.
Yeah, a couple of things. Mechanically, when we're doing exercises, we want our whole spine to be working as a team. Very commonly, especially when you're doing a pull-up bar, your chest has got to be locked, right? Because you don't do it like this, right? You lock your chest to do the exercise, right? Or if you're bench pressing, no mobility of my chest is required to bench press, right? Nobody bench presses with a loose chest.
They shouldn't.
So, right, well, poor technique. But my point is that some vertebrae has to move, right? Mechanically, if my chest is locked, then usually the areas above and below are more likely to be the ones that the forces go into. The imaging that you have, I kind of find it, it's very interesting because you have x-rays taken and MRIs, which is one of the things that I like MRIs because they give a higher level of detail. And in this case, we could sort of see both scenarios where I believe the x-ray doesn't serve you justice in showing the extent of your injuries. And I think you've already been over these images with your doctors, but
Yes.
just as a brief. So on your cervical MRI, we have 3 levels of disc injury. Right, so we're looking to our left. Your jaw would be over here. These little pieces of cartilage here are the discs, and let me zoom in a little bit more. Yeah, right. These 3 levels here. There's disc injury hitting the spinal cord there. So the bone has actually grown a little bit there. It's actually pushing out the ligament called the posterior longitudinal ligament, and that's inflaming and hitting the spinal cord. And this is what's going to give you symptoms down your arms, pressure, even shoulder blade pain, shoulder pain, arm pain. All of that comes from your lower neck is older than you are. So, I would say this is like a 70-year-old lower neck. The good news is how young and brand new your upper neck is, and that's where we're going to spend some time today.
Okay.
Loosening and doing 2 things, diverting stress off your lower neck. And again, it goes brand new here. So brand new, brand new, brand new, injured, 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 brand new, brand new. And we actually can see the cartilage which is in contrast to an x-ray where it just shows the cartilage as a shadow, because you don't see your ear on x-ray. You only see bone. So we can see the bone. I'll show you the x-ray here. So now we're facing the other direction, but the x-ray shows these shadows where the discs would be, and doesn't really give a good appreciation for where that disc is and what's causing symptoms. And you might even look at this kind of x-ray and go, hey, it looks pretty good, other than the alignment straight, the loss of curve, that presumably the lower neck's under more stress because the curve allows the weight to be evenly distributed, but because this doesn't look so bad until you look at the MRI and go, wow, you have 3 disc injuries and we need care.
Mm-hmm.
We need disc rehabilitation. We need cervical lordosis restoration, and that's how we're going to slow the movement of that disc posteriorly. The disc actually doesn't want to be out there. The only reason it's forced out towards the spinal cord is because you have such interdiscal pressure on the front due to the alignment, right? So the alignment is creating mechanical pressure here, and that's forcing it out. This is all pressurized in here.
Yes.
So we call it a vacuum effect. When you depressurize the front, we're going to actually create a movement where that disc is going to move away from
Negative
the spinal
pressure,
cord.
yeah.
Right.
Yeah.
And that's going to, at the very least, prevent it from growing farther. We have to be able to compress the back side. So the joints are loaded with pain fibers, and the joints are right back here. So many times, because the joints have a lot more feeling, so we desire to go forward because the joints have feeling, and also the hole the nerve goes through on the side gets larger when we go forward. This is why you see people aging rounded forward. Same kind of things going on in the lumbar. We have the first lumbar, where we have this guy's a little bit older, but brand new, probably about age appropriate. He's about 45.
Mm-hmm.
This guy's 75.
Right.
This guy's about 50, 55. So we have one disc injury there where the disc's gone past the back side of the vertebrae. So we have disc material kind of like sticking its tongue out
Mm-hmm.
and hitting the spinal cord. The disc material's hitting the spinal cord. This is what's going to cause leg symptoms. The thing that's important also to understand with why this happened is the discs cannot handle shearing forces. And what I wanted to, and I'll show you the x-ray in a second, and it does not show this as clearly as this picture does, is the back side of the vertebrae should always line up. So when I go up here, notice how perfectly, if I took that corner and that corner, does that make sense?
Yes.
They all line up.
Yes.
Perfect line up.
Yep.
Perfect line up. This guy does not line up, where actually the back side of that vertebrae here
It's slightly
is,
forward.
you see what I'm saying?
Yes.
That vertebrae is forward from the back side of L5.
Okay.
And that's what's creating a shearing force, because if we took another picture of this and the x-ray doesn't, again, show it very well, they tried to with the flexion extension they took on you, but that creates a grinding force. There's a mechanical grinding force. There's ligaments that are torn that if I took an MRI of you bent forward and bending back, you would see this would shift.
Okay.
And that's what I was trying to say earlier about what the discs are like. The discs are like rubber erasers that we had when we were kids. You could take a rubber eraser and throw it in the street and drive over it in your car, and it'd be undamaged, right? It can handle compression, right, that rubber eraser. But if I take that rubber eraser and twist it in my hands, I can rip it in half.
Yes.
Right? It can't handle twisting or shearing forces. So in the same way, these discs in here, they don't like grinding forces. They don't mind compressive forces, but it can't handle that sliding force. Because of the age of the disc, this happened at least 15 years ago. The thing that caused the whatever caused the ligament to tear, which now has caused the shearing force, and now we see the effects of the shearing force, takes 10, 15 years
Yeah.
to get the disc out there. This didn't happen a year ago, even 5 years ago. This happened at least 10, 15 plus years ago, is where the trauma, fall on your butt, fall out of a tree, something happened. This was not just living your life
Yes.
that tore that. There's a trauma that tears a ligament that then accelerates the aging of the disc, and now we have pressure on the nerves. There are some chiropractors that want to do things, even in chiropractic biophysics, they want to try to, lift the sacrum. So in your case, you could push here on L5. Does that make sense?
Yes.
Try to bend the knees and actually drop that back. I'm a little hesitant on that. I find that any type of care trying to realign that purposefully ends up further inflaming it. So I've tried that. I have experimented with a dozen other patients and trying to, some like it, some get a little bit worse. I found the most success is to leave it alone, to like mechanically stiffen and restore the curve up here, and loosen the middle back up here. And that's
Okay.
what we're going to talk about and work on today. I do not believe it's the best care. I would first go through at least a few months of care, working the areas around and adjacent, restoring mobility away from, because what this picture doesn't illustrate is how loose that is, right? When you move, this is like flopping all over the place. Do you understand? That's
do.
why it's injured. So because it's so loose, further care that goes into that area ends up potentially loosening it more, which then makes it more mobile, just more inflamed. And I would only do that as a last resort, care directly on that area. I believe a better care is to like back brace, stiffen it up. Do you understand? And we're gonna restore the total loss of curve in your upper lumbar
Okay.
and take the pressure off the front by just molding to that lumbar curve and let that be the thing that kind of realigns your spine is the lumbar dental, and we'll talk. The x-ray I was going to show you, again, you're facing the other side. You really can't even see it. That's where I wouldn't be able to see that misalignment.
Okay.
That forward back movement
Yes.
to me is invisible on your x-ray. You cannot see the explanation, and even the height loss. There's really not. Minimal. Does that make sense?
Right.
You really don't even see. You see these shadows here, but you can't see the disc. And so again, we're left with, I'm in pain. I'm dying here, Ed. The X-ray, there's a loss of curve here, and you miss the fact that not only two things are going on. One, there's a shearing force. Two, notice how the discs are white. So they're supposed to have water in them, and as the disc ages, it becomes like bacon. It dries up and gets hard, and you can see the darkening. Notice that's a lighter color. That's the nucleus there, and how
Yes.
this disc is starting to become darker. So you actually get to see how that disc's aging with MRIs, and like I said, prices of MRIs have come down to the point where I'm like, I'm glad they took MRIs too.
Yeah.
It just illustrates further why I like MRIs over taking X-rays. Okay, 1 second. Left shoulder's a little high, not too bad. Left hip is high. Okay, relax. Dealing with about a 2-inch forward head posture. So the center of your ear hole should be over the center of your shoulder. Every inch the head goes forward from your shoulders, the muscles have to double their workload. So head weighs about roughly 10 pounds, 10, 20, 40. So then you do an exercise with the lower neck already mechanically under more stress that then loads it more. It kind of amplifies and exponentially increases the load that the lower neck is under, especially when you're doing a gym workout.
Right.
So my first, I have golfers that come into me and go say, Dr. Ed, if I can't play golf, I don't want to live. And so if the gym is where you want to be, then I'm your man, but we got to get your whole spine working, and we have to do things to bring the alignment back into position so that we can do those things safely. Turn your head left, turn your head right. Is there pain when you do this?
More on the right.
So when you turn your head to the right, there's pain on the right.
Yeah, it's hitting the pointer
nerve.
finger and the thumb.
Okay.
Yeah.
So it would be the same thing probably with tilting. Like, so if you tilted your head to the right,
I'm starting to feel it in the shoulder
Yeah.
now. If I keep going,
it's okay. It's okay.
I
I don't need you to stress it. Just so the point illustrates what's happening with that is that when you turn your right rotation and right lateral bending are the same thing. Mechanically, the holes on the right that the nerves pass through get smaller when you rotate or turn to that side.
Yeah.
So when you turn your head right, symptoms on the right mean that those disc injuries are getting closer and putting pressure on the nerves that channel down your arm. When you bring your head up, when you try to look up at the ceiling, go ahead and try, just gently look up. Is there same kind of thing? How does that
I'm
feel?
just feeling it maybe just a little bit on the right.
Okay. All right, then probably it all goes away when you bring your chin down.
Yes.
Yeah. So this is again why patients compensate and we end up avoiding, and people will go into avoidance for decades. You understand? And that's another, there's a reason your head's 2 inches forward. It didn't do it willy-nilly. You understand? It didn't do it for no reason. It did it because I have symptoms and I compensate. All right. Take one deep breath in for me. Just a little sit up for me. And then exhale for me. And I'll go. All right, deep breath in. Exhale. All right, deep breath in for me. Exhale. All right, again. If your chest moved beautifully, I'd be confused, right? What was that, Ed? Why'd you do that? I just asked 12 vertebrae to move. I got maybe 4 or 5.
Okay.
Right, so we don't have all 12 cylinders on your Lamborghini engine running. Right? You're running on 4 of them. So you're not making as much horsepower, kind of idea.
Yes.
So we need an engine tune-up. We got to get the other 8 cylinders working.
Yeah.
Again, it's not your fault. It's not something that make your vertebrae move. That's not how it works. They have to be showing up, and then you can utilize them. There's a couple different things that you'll see in case you're in another city, another chiropractor works on you. I want you to be aware of this. There is no benefit to adjusting that area that's injured, where that sliding force is going on. There you go. The goal of this adjustment is to do to bring you back into that curved position and to loosen the adjacent area. So you'll see me do 2 things. I'm going to put my hand up in your middle back, try to loosen your middle back a little bit, and then also the SI joint down below.
Right.
Okay. So if a chiropractor places their hand on your lower back when they're trying to, be cautious.
Okay.
Just please don't let somebody do that.
Okay.
All right, put your hands in your belly. All right, take a deep breath in for me. Just gonna stretch. I got you. So up here, there you go. There it is, good. Get the idea? Right?
Mhm.
That's your middle back. That's, again, what I could see on your MRI is not injured. This area up here is not injured. His area of injury is right down here. Again, no chiropractor should, you understand, trying
Yes.
to do something to your lower back. Please, don't let that happen. Breathe in for me. Easy. Get the idea?
Mhm.
Right? We're trying to loosen that joint below. Other side for me. Someone might say that it looks cooler if you did a huge body drop on him and slammed him and got every bone to crack. The problem with that is, yes, I would move the ones that were stiff, but only after I fully moved all the ones that were loose. And so I didn't balance you, right? And that wouldn't be good for you, even though it might make a cool,
Yeah.
But we're supposed to be specific here, right? We're supposed to be adjusting. We're not supposed to be manipulating. Manipulation is, let's see how many pops I can get out of your back. An adjustment is, let's try to focus force into one area and actually try to avoid putting any force into another area. Inevitably, yes, a little bit of force went into your lower back, right? 95% went here,
Right.
And it is impossible to put 0, but we can still avoid putting a large amount of force. Okay. For some person on the internet, no, a little bit of force went into L5. Yes, it's still moving. They're all connected like a links in a chain.
Mhm.
If I move this one, that one moved a little bit,
Right.
but I didn't directly punch the one that was injured. Okay. Incorrect, Dr. Ed. There you go. Good. Gotcha. Mm-hmm. Good. Notice how loose that was, right? That's part of that injury in there. It was like moving before I even pushed on it.
Yeah.
And that's where, again, I worry. You lay on your back for me.
Well, a bit of a self-cracker.
Right. 2 ways I'm going to help you with that. One, as we take stress off your lower back and the inflammation in the joint goes away, that's the pressure you're releasing when you self-pop. You won't feel the need to do that. That's our goal with this, is you won't feel the desire to, you understand that desire to release that tension in there, because, first of all, it won't be inflamed, because the middle back will be working, the posture will be better, and then secondly, as we get your whole spine working as a team, you won't be able to pop it. The only reason you're able to pop your lower back is because you have this so stiff, you're able to isolate this and pop it. Does that make sense?
Yes.
Yeah, he's on left. This side's willing to talk to me. The left side's kind of passed out. Not even awake. I gotta wake him up. 24 vertebrae. We only gave names to 2 of them, right? The atlas
and the
axis.
axis.
Right?
Yeah.
I mean, well, no, Dr. Ed, lumbar 5. Okay, lumbar 5 is not a name. That's just like a... That's lumbar 4.
Yep.
Okay, it's not really...
Somebody's got to find
It's like,
a reason to nitpick.
it's like thing
right?
1 and thing 2. Yeah.
Yeah.
It's not really... Thing 3. It's my 4 kids' names. Thing 1, 2, and 3, and 4. Those aren't really names. And they all share the same thing as the beginning. So, right, cervical 1 and cervical 2 are never really called C1 and C2. We call them by their names, Atlas and Axis, and so we gave them names because of the large amount of importance that they hold and effect on the entire spinal health. And if they're not working, we're in trouble. Hello. That.
Yep.
There is your problem. It's got like a ridge on it. It's a hip from the left side. You know, I don't know. What did you do in high school? What was your athletic stuff that you did in
Soccer and a lot of long distance running.
There it is, soccer. So some collision from the left. This joint got injured, and then you healed on your right side in avoidance of it, and like you hit a curb with your car and it knocked your alignment out, right? And now then you drove to California on a bad alignment, and your tires are wearing out unevenly, right? So you want to bring the spine back to the right alignment. That's the.
I think a lot of my neck issues were post high school though. The Marine Corps was not very easy on it, and their martial arts program was pretty rough on it.
Gotcha.
And at one time I did have a kyphotic neck, and the first chiropractor I went to, we were able to get the cervical curve where it was supposed to be. And then it went straight.
Mm-hmm.
So the second chiropractor I went to, we did some extreme traction to get that back. But that's, 26, and I'm 43 now, so.
I gotcha. All right,
Yeah.
well, we're not trying to create things new by bringing the curve back to your spine. We're trying to bring it back to where it used to be, right? So it's like you used to ride a bicycle, but you haven't ridden in 17 years or 20 years, and now you've forgotten and you're crashing all over the place, and you're getting mad. This is impossible! Well, you used to know how to ride, but you have to remember how to ride.
Yeah.
It's kind of a bringing you back to where you used to be. Care. Yeah, right up here on the left. That's the. That's where it's at.
You were getting any red and purple right away?
We'll see. Yeah, let's see here. Might get some right there. Yep. You see it right there, babe? That's the.
Have you had gua sha done before, Kaveen? Or?
No, but there is a massage therapist I went to. She did some scraping. I wouldn't exactly call it Gradston, but she was doing some scraping.
Okay.
And yeah, I was getting purple, red. She did some cupping too.
Okay.
Yep.
Yeah, right there. That's the. You're just restoring the function of your upper neck here a little bit. Okay.
Well, I am using a cervical pillow, but I think my head is resting in the center instead of on the ends, and that's probably what's aiding in that curve.
Gotcha.
So.
All right.
Oh, baby. Wow, that shot down my left arm.
Down the left arm.
Yeah.
Okay, well, waking it up.
Yeah.
Left arm's got to wake up.
I didn't say it was bad, but yeah. Good stuff.
Yeah. Now it's gone. That bump is. My point is that now we have to mold it. We want to mold you now. Back into this position. We got you all loosened up. The thoracic outlet, the funnel that the nerves pass through to get down your arm, and so it's like the game Operation. There's very small tolerances. We're trying to move an object through a small, like a three foot wide dresser down a 3 foot 3 inch wide hallway, right?
Yes.
And if you hit either wall, we're going to run into a nerve. And so we have very low tolerances. That's part of what happened when I loosened this. A little bit of movement happened here, and then the nerve gets, but the nerve's already hyper excitable. It's already smushed in between two objects, and so any little bit of movement's going to have the ability to compress the nerve, and we have to get your upper neck loose, and we have to bring your curve back in your neck, and then the ability for that to happen will go down as we bring the rib down,
Yeah.
as we clean the channel that the nerves are sitting in, which is what the gua sha does and the massage. So the three components of thoracic outlet, vertebrae in the neck going in, rib and the upper back going down, and then the tissue that the nerves travel through being cleaned. And this is how we reduce that pressure on the nerves that go down.
Yeah, I got some fantastic tingles in my fingertips on both hands and through the arm. A lot on the left, some on the right.
Yes, I understand. That's just, the nerves are already, like I said, they're at their wits' end.
Yeah.
They're, all it takes is a little,
Yeah.
ah!
Yeah.
So it's like orthodontistry on your teeth, right? It's 2 years to me to get 99% or 95%. That's a diminishing returns curve. 3 months of the dental roll, you'll be 50% done.
Okay.
You know, and then in 9 months after that, you'll have another 25%. So you'll be at 75%.
So
complete.
diminishing return.
It gets harder and harder to get to perfection,
Yeah,
right?
yeah,
So
I gotcha.
after 1 year of dental roll, you'll be 75% of where we need to be.
Yeah.
And then the next year, you'll be getting another 20%. You're saying, so it gets harder and harder to get that full, you know, it's kind of like sanctification. You never reach
never
it, but
quite right,
we're all
yeah.
aiming for it.
That's
We're
right.
aiming in that direction, and so we're aiming to bring you as close as possible to the ideal position, the ideal spinal alignment, ear over the shoulder.
And just for everybody watching,
Yeah.
it hurts like crazy.
Uh-huh.
I'm just not reacting to
He's
it,
amazing.
I guess.
I was like, you were very calm.
The lady I go to for when she does deep tissue, she told me right now she puts the most pressure on me of her
Of her
with the
client.
folks that she sees. Sometimes she has me screaming though. And I told her, I said, don't stop unless I throw up, pass out, or say
Oh.
stop. So she's like, okie dokie.
You're really purple already right here. Like this. Wow.
Yeah, this is a huge part for why you're feeling those symptoms down your arm.
Oh,
The
it's
nerves
so-
have to travel through here, and a lot of inflammation. There we go. Yeah, there's always cause and effect, right? You have injury, stiffness, and then compensation. Another area picks up the slack and load for another area quits. And to me, the job and focus of the care should be to identify all the ones that are underperforming and leave alone the ones that are overperforming, because the ones that are overperforming and inflamed are actually working.
Right.
They're actually mechanically working. They're doing too much, and our world looks at them and says there's something wrong with them and that they're diseased, and then it's like,
Well, not really. I mean, the inflammatory response is
Right.
natural.
right. And nobody's poked up here very much, right? little
The
bit.
massage therapist did. Yep.
Thank you. But the chiropractors are not paying attention much into here.
Not a whole lot.
Mm-hmm.
No.
This is the whole cause.
And the concept of massaging while you're adjusting or in between
Doesn't exist.
doesn't really exist. Yeah.
That doesn't really exist, Ed. So
Yeah.
I've had people that travel the world and go, Ed, nobody does this.
Yeah. In and out 15 minutes. Yeah.
Right.
Yeah.
I find that we can get a lot, a better adjustment, deeper care, and then even more effective stretching because we do the soft tissue work as a way to expedite the time it takes to make the vertebrae actually function, ultimately leading to you don't need 100 visits. You're saying that something like 8-10 visits we can have you on a pretty good path for self-care and home care, and we'll try to give you as much as I can today and teach you how to do stuff at home, but it's locked right here for sure. That's what, I'm glad your massage person at least working on it, but yeah, keep helping them focus up here.
Your timing, I will say, doctor, is
Yeah.
rather amazing because I'm scheduled for a microdiscectomy on that extrusion on the 25th this month. We didn't know if we were going to make it or not.
On the L5 one?
On the
Or L4,
the
L4, yeah,
L5.
L4, yep.
It's broad based.
Mhm.
It's been there for close to a year.
Mm-hmm.
I don't know what your thoughts are on that, but I'm kind of at my rope's end because of
Right.
my pain level
Right.
and the symptoms that
Yeah.
it is causing are, I don't know.
Sure. No, My first, we want to say, if you lived here in Sarasota, I would say give me 8 visits. Do you understand?
Right.
And we'll
right.
know.
Yes.
We'll know, not in 50 visits, not in, so if you did 3 times a week, we've done 2 weeks, 2-3 weeks, we would know,
Yes.
is this working or is this, generally you have 3 visits of hating me, okay?
Oh, I'm loving this.
3, well, tomorrow morning.
Right. I got you.
3
Yeah,
visits
when I
of
wake up.
the next morning,
Yeah.
what the heck did he do? You have about 3 visits of that, and usually by visit 5, people start to go, Ed, I see what you're doing. I see how we're shutting down the area that's injured. That's starting to feel better, and now my middle back's killing me.
Yes.
But I'm no longer feeling my disc injury down here. I'm now feeling the source of my problem, the frozen areas that were there all along that I didn't even know existed. They're now the ones that are the yelling the loudest. And then by usually visit 6, 7, 8, somewhere in there, people, we get to a place of peace.
Yes.
And the middle back starts to just do what it's supposed to do. And at that point, usually most patients can take the reins, do their home care. My point is that it can be repositioned, that the disc doesn't want to be out where it is, but it will stay out there if we don't take the weight off the front. We can't arch you back because your back's frozen.
Yeah.
So we have to loosen you up, make the clay soft, make the metal heated up and soft so we can reforge it back into the right alignment.
So the fact is, it was an injury that appeared to be getting better, and I re-injured it from October to
I understand.
February.
Yeah.
And then after that occurred,
Right.
it was not moving, and my pain level's been,
Yes, sir.
I don't know, borderlining on 8, but
Sure.
generally 7 to 3 each day.
I understand.
And usually it's when I'm standing. I mean,
Yes, sir.
that makes a whole lot of sense, but it's getting to a point where it's,
Right. I'm dying here.
you know,
Mhm.
it's rough.
We
I
have
don't
to-
want the nerve root or the fecal sac.
I understand.
Because I do know
Yep.
the fecal sac has some
Yep.
involvement.
Yep.
I don't want to keep it in that position
Yeah.
because, as I understand, and maybe you know more about this,
Please.
arachnoiditis,
Mm-hmm.
you can cause that.
Mm-hmm.
Hurts so good. I'm certainly thinking, like, why didn't I try to get a hold of you like 6 months
I
ago?
know,
you
it's
know?
so tough. It's so tough.
Well, it could be because of all the other stuff I tried.
Mhm.
I mean, honestly, so people can hear. It was chiropractic, then it was decompression, plus 3 epidural shots, which the epidural shots did symptomatically.
Sure.
They did relieve some of the weird things that I'm feeling because now they've had a chance to wear off, and that inflammation down there, as well as the mid back, it is causing symptoms that weren't there just a month ago. Then there's let's see, physical therapy. Gosh, what am I missing? Acupuncture. So the whole gamut of stuff. It's like I got to get a hold of Dr. Ed.
Yeah, the problem with traction is twofold. One, pulls your spine straight. Wrong position. But does that make sense? If I traction you, if I just do straight traction,
Yeah,
notice how it pulls us straight.
yeah,
So after you leave the office, you're actually in the same or worse alignment where now it's straight all the work. Right when you take that first step, it goes right back to the area that's injured. Yay! You didn't put the curve back in. It's not supposed to be not supposed to be ortho, right? It's supposed to be lordotic.
yes.
Curved.
Lordotic, yeah.
Second problem with straight traction is that the disc is actually glued to the bone, called the end plate. So when that disc is sandwiched in between the bone, they're actually in contact and glued to the end plate. So when you traction the vertebrae, you're actually pulling the disc open, and any tears in the annulus or the outer part of the disc actually get gaped and kind of like a cut on your skin, and you just pull it open,
Okay.
right? You're actually tearing the wounds open. Now that disc has no feeling, so you can't feel it. You don't do straight traction, inversion, pulling, because it's one, the wrong alignment, and two, and then where's the most traction happening? In the loose areas or the stiff areas? Which vertebrae are tractioning the most when you're being tractioned?
Loose. Okay, now
So you're not doing anything to the stiff area.
Yeah.
Traction, No, you don't do that to the disc. But again, they get away with it because the disc doesn't have any feeling, and we don't know that we're damaging it. We can't feel it. That didn't hurt Ed. It felt pretty good while I was doing it. Right.
Yeah, because the disc wasn't feeling anything.
You can't feel any tears in the discs. Those discs, you could be shredding them more and you have no idea. So this is all clogged. All these marks represent the congestion and stiffness and lock that has been in here. You've cracked that tooth. It's time to give it a break. And you've established habits, over a long period of time. And
Cognitive dissonance.
right.
Yeah.
Right.
What a terrible thing sometimes.
Wow.
You're going to find some good stuff down here.
Ooh,
Yeah, you're going to find some good stuff down here.
what is that?
I try to do some foam rolling, but, just ain't the same.
Correct. And roll credits.
Yep. I'm trying to get into a position to even foam roll is difficult.
Mm. Right there. Ooh.
So what I'm feeling right now
Yes,
is
sir.
my ears,
Uh-huh.
my fingertips, my forearms. My fingers are literally contracting right now. My forearms are getting tight.
Yeah. Put them underneath your thigh. Put them underneath your thigh. Put them underneath your thigh. Put both of them.
Oh, okay. You don't want me to go into shock or pass out. My massage therapist did this. We just keep going. I haven't passed out yet.
No,
and it's
that's-
been worse.
This is
Is this
you
a
think it's
nerve?
something-
Is this a nerve issue?
because the table's holding your head back.
Oh, what? Okay.
You understand? That's all that
Okay,
is.
I got
The
you.
table's not letting you, like I said, I was trying to say earlier, you've stretched face down now for about 30 minutes now, 40 minutes.
Okay.
You understand?
Okay.
Your head is being held in the position it's supposed to be in, but it's not letting you compensate. You
Okay.
understand? The way we can alleviate this is I could lift this chest piece and then let the headpiece drop, and then I could let you put your head forward, and
Yeah.
it would go away.
No,
But
I'm good.
The goal of the care is to bring you upright. One of the things I showed you, or I was looking at when you were standing, is that your head's 2 inches forward.
Okay, yeah.
What does that mean? It means that being in neutral isn't going to be comfortable.
Okay.
That your head's in avoidance, and this table face down doesn't let you avoid.
Gotcha.
And when you're face down on any table, now, I don't like hitting nerves. Do you understand?
Yes.
If we're hitting the nerve, I don't believe it's good to power through that. I would try to move. You understand?
Yeah.
Now, as we do more on the dendral, that won't happen. Do
Okay.
you understand?
Yeah.
Fairly quickly, by visit 3 through 5, that symptom should be gone. Typically, do you understand?
I do.
But so if that is happening in other places' offices, I would try to move your arm up and down, put it underneath you. You understand? Bringing your arm in the position now opens up this channel, and
Yes.
it should go away a little
Yeah.
bit. But that's again, we're compensating. We're just moving we're made up of little holes with wires going through them.
Yeah.
Right? So if I move your arm around, I can change the position of that hole, and it's gone away, Ed. Right? It's not really gone away. It's just I moved to mechanically open it up a little bit, but you should be able to have your arms down there, and that doesn't happen. That's happening because you're on low tread. There's not much tolerance for bringing you back. Hence why your head's forward. Hence why you're here, and why there's disc injury.
Yeah.
Are you okay though? Do you need?
Did it calm down? Did it calm down
Ever so slightly.
slightly?
Yeah.
Yeah, but wait, sit up for me a little bit. I'll show you.
Take
Yeah,
your
just
time.
easy.
It's a lot.
Yeah, just come up a little bit for me. I can show you how on this table it can be. The idea would be this. Easy. All right, lay back face down if you can. There you go.
Just take your time.
Easy.
Do you want water?
No, I'm good.
Yeah, this has happened like 5 times now, and it's really okay.
Now that should calm it down now, because now I'm letting your head go forward. Do you understand?
Yeah.
I'm letting you avoid, and it'll get better. Now, I guess at a massage therapy, if they don't have the ability for this, they'd put a pillow underneath your chest.
Okay.
You understand?
Yes.
You can put a pillow underneath your chest to elevate your chest to let your head. Does that make sense?
It does. Yes.
Straight forward. Now, that shouldn't be a long-term crutch that we give you. It is something that we should work through, but I don't want to sit there and upset the nerves. Do you
Okay.
understand? I don't
Yes.
I don't think that's beneficial either.
Let me know if the light's okay.
Yeah,
I
the
need to
light,
move it all.
the light is good. It's crazy. It's just so purple.
Holy moly. Whoa.
Yeah.
Yeah.
It's clogged.
That's clogged.
Yeah, this is all. So when you're bending, no wonder your poor lower back. And then when you're tractioning, this ain't tractioning. It's all frozen. It's all destroyed down here, and your lower neck is doing all. I mean, you can see, but there, all the bending happens right in that little crease there.
Yeah.
That's where all. So I'm trying to create a new crease up there at the top, where you're not injured, and make a new fold, like a piece of paper. You kept folding it back and forth in the same crease, and now it's starting to tear.
Yeah.
We have to create a new.
I'll get that pack of hot dogs fold going on back there. Yeah.
You press back with your shoulder. Yeah. Put it back. Good, it's okay. All right, go ahead, tilt to the right, tilt right. Tilt right.
Can you explain what this stuff is?
There's
Tell you what, let me take
Sure.
this.
There's adhesions that form behind the ear. What is the scar here? Is this from the scar on the right side? What is that from? You remember? Is it just from your glasses?
I
That's just your glasses?
think so. I don't recall getting injured back
The
there.
dent,
Oh,
that's his glasses.
Just his glasses have been on there. So how were you first had glasses?
Say again?
What age did you start wearing glasses?
Oh, ninth grade.
Interesting, because actually your bone has like gotten like dents in them here
Cool.
from your. Maybe not so tight on the head. I don't know. I'm
That
just-
would require him to go to an eye doctor.
An
Okay.
optometrist, yeah.
like your head's wider than the. I mean, like it's actually. I mean, this bump here is not normal. Like,
Do you know how annoying it is, though, to have your glasses sliding around?
okay, fair enough, but you got them so tight that they've actually dented
it's like
your.
how your thumbs are growing because of your jaw. You
Oh.
just gotta. What is he doing? He's like,
Smooth
feel-
here.
Yes, I feel the
Right,
smoothness.
smoothness. You have a literal.
You're
dent
not,
there.
you're not wrong about that.
I'm just saying, whatever, no one cares. I'm just saying, your poor skull's been dented. I got you tilt left. So, especially with a dent behind your ear, it's very plausible that the channels that drain your sinuses in your ear and your face drain right past that, right?
Mm.
This area is the highway that drain ultimately to your blood system and you pee stuff out. So your sinuses, your frontal,
Yeah.
that's the highway, and the dent is right in my road. There's like a big speed bump that potentially.
His glasses like maybe I.
Put it back on.
Maybe I shouldn't put them back on.
The device is called a lumbar dental. It is a orthotic used to do two things. One, loosen an area that's stiff and maintain its mobility, and then two, bring the spine back into its lordotic curve, the arch. I have some books behind your head to reduce the depth. The most important thing when stretching on a dental is time. We want to first get to 20 minutes of time stretching. 20 minutes is not a made-up number. A number I thought sounded cool, and I said, yeah, 20 minutes sounds pretty good. 20 minutes is a real number for how long it takes to stretch ligaments. Okay, so the rubber bands that wrap your spine take about 20 minutes to mold into a new position. That is not to say that 5 minutes is useless or 10 minutes is useless, but you will not see a permanent change until you are reliably getting to 20 minutes on these stretches. The depth of the stretch is not as important. It is important too, but it is not as important as getting to 20 minutes. So at the beginning, when you're starting stretching on dental rolls, I first want you to get time in, and then we can, you understand,
Yes.
reduce the amount of support we put behind your head to increase your depth to the point where there's no books behind your head, and actually you would be on a much larger dental roll. Can you show me the back raise? Come on for me. Yep. When you're ready, roll to your side. Yep. Side push up. So that's really, really concerning and sad that nobody's brought about simple $25. It's a really cheap way to, very inexpensive way to get some relief. You know, just put the air definitely. This is Velcro on the top here, so when you grab it, you grab this. This one goes on top. You just pull that tight, and you get in. You just pull tight if you want, but however level of tightness you want. You want to girdle that lower back. Just you put the center of that right over the. You know, it's just not. It's not that complicated. Just something to stiffen up that lower back a little bit to give you, just when you're moving around, you don't have to be so cognizant of using your muscles to protect it. Now you can
Right.
just let the brace. Now you're right, it'll constipate you if you leave it on all the time, and maybe the muscles get weaker underneath, but we have an injured disc. Muscles, schmuscles, they'll get strong, and but the disc is not a healable structure. Discs don't regenerate. They're like enamel on our teeth.
Yeah.
Once you destroy your enamel, it's not coming back. So that disc can be repositioned, it can be rehydrated, but I'm being clear, it's not regenerable. Any tears in the disc don't heal,
Right.
right? We're not in a phase in medicine where we have the technology to regenerate a disc. They're trying. Maybe when they do that, I'll quit chiropractic and start injecting stuff to regrow discs. Because the whole point of why we got to be on a Denerol is because the discs won't make it to 90 if we don't have the right alignment and we don't have that curve in our lumbar. Like on the X-ray, it's going straight, and all the weight like a ladder is going to the bottom. There's your problem. How long have you been in that alignment? Ooh, decades. That's why those discs are ruptured. Same principle. Just molding your neck back into that curved position. Kind of middle upper neck. I'll take my hand, place it on my forehead, get my head to sink into it. That make sense?
Yep.
And then put your hand back down and relax. And just same principle. Just trying to restore the curve to your neck. Its effectiveness goes up when your neck is loose, right? So when your neck is stiff, this becomes a better tool on visit 5. Up here, and then you'll push to get your head to go over it. It might slide down a little bit when that happens. That's okay, all right? So I want it target the middle upper neck. Like I said, if your chin is down, we're not doing it right.
Do you want me to rotate slightly to either side?
It would be to your left.
To the left.
It would be to your left to work
Okay.
that left knot. Now that would be not more than a month prescription because it will change. I had a patient here the other day and it's gone. Like it's less. I said, now just go center.
That's great.
I mean, probably by visit, I think he's probably visit 5 or 6, and I don't feel any laterality anymore. So I'm like, just hold it right in the middle now. But yes, for the first week or two, it will change quickly. That left side will go in. The right arm should start feeling better when that starts to. So, because essentially you're doing this. Do you understand? You're in right lateral bend, which makes the right side pinch easier. So when you turn to the right, you're already pinching it, and then you pinch it more because you're hypermobile on that side. Go ahead and turn your head left and right. Just tell me how you feel, and just by turning, how that feels to turn your head left and right. Turn your head back to the right for me. How's that feel when you turn?
Not too bad. I'm starting to feel it now here.
Right side, uh-huh.
Yeah.
Do the same thing. Look up for me. Uh-huh.
Oh, I'm starting to feel it.
Just way deeper though. Way deeper till you started feeling it. Than
Yeah.
before you kind of
Yeah,
you went to
for sure.
a lower level.
Yeah.
It's a process of rehabilitating those discs.
Yeah, so
Left side.
everything is all on the left. It's pretty much like from here down, and it's all around here, this area. And it's the back or the shoulder blade, like the scap, and it's from the spine to the shoulder blade.
Okay.
That's a lot of knots and a lot of issues, and
You
it
say
seems
almost a year, just a year, or how long total?
that's when it really got worse.
Okay.
But I've always had issues with that left side.
Okay.
I don't know if it's because I've always had jobs where I had to either hold something on the left,
Uh-huh.
so it's always been aggravated. Like I'll get these knots, especially on the left side, and I'll have to either get a massage or lately I've been just using the lacrosse ball.
Are there any symptoms down your left arm? I see this says numbness, tingling. Where
It's usually when I wake up, it's during sleep. I'll have like numbness and tingling.
all fingers, certain fingers?
Sometimes it's these two.
Uh-huh.
Sometimes it's these right here.
Uh-huh.
But it's not really. It's not something common. The numbness and the tingling is not something common or happen during the day.
Okay.
I've also had a really bad injury on the left side here,
Okay.
where I fell off a bicycle.
Okay.
And I landed like that. So I hit this whole thing and it turned black and blue. I didn't break anything.
How long ago was that?
22, maybe 21. 2 years, so
2 years ago.
yeah.
Okay.
And
So, bicycle injury 2 years ago.
bicycle injury 2 years ago.
Hit that
landed
real hard.
like that. Yeah.
How did that affect the shoulder and the neck? That kind of made
It
everything worse?
didn't. It didn't. The neck. It had to be from way back then. So what happened with the neck? Let me just go back a few years before the pandemic. It's actually 2019 or something.
Okay.
where I went to the gym and I was doing these assisted pull-up to warm up. It's not a regular pull-up with your body weight,
Right.
but these assisted ones that you put your,
Right.
just to get my upper
Yeah.
body warmed up.
Warmed up.
And the minute I got to do the first few reps, I felt something like
Shoot.
shoot.
Uh-huh.
And instead of just going home, I continued the workout,
Uh-huh.
which is the next day resulted. I got up and I couldn't even move my neck. I just can't remember which way to turn, but it was all on the left side. And then this left side has started to get harder and harder, especially the top, and I could just feel it.
You hit a nerve. Yeah, we're hitting nerves in there. These actual cables that come out from the side are held very tight. So we call that tethered.
Right.
And then when you turn or rotate, they don't have any ability to kind of move or roll with the punches. And so then you hit the nerve. Then the muscles get tight to try to guard and protect. So the workouts typically, one of the things that lifting weights or pull-ups will do is that it's very common for your neck to want to get pulled straight. You'll see this commonly with somebody who has a bicep curl, right?
Right.
With bad technique, you'll see people going,
Right.
right? Because it's harder to do a bicep curl with a curve in your
With
neck.
the curve, yeah.
You want to flatten out your neck, do you understand? To do a good, and so most exercises in the gym, you're better at them, you're more powerful, you're more efficient with no curve in your spine. So this does a couple things. It tethers the nerve roots, and then it also, that straightening puts an extra pressure on the disc. And the discs are non-sensitive, and these are represent kind of the enamel on your teeth. They don't have any feeling, and so this takes 10, 20 years for us to realize that we're putting stress on the discs, and now those discs are starting to come out and actually start involving pressure on those nerves, similar in the neck. The discs now start to occupy space that nerve now had some ability to move away from the bones, but now the disc's in there hitting it too, and now it's surmounting to a point where now, Ed, I can't get away from it, and now I can't turn my neck, because when you turn your neck, that hole is moving, and now you're hitting the wire.
Yeah.
The sensation into your fingers is the C5, 6, the nerves in your lower neck are the ones that are involving with that numbness.
With the numbness.
At the very least, it's a sign of low tread, that we're getting low on the tolerance for that nerve to be irritated. And so it's not all the time, because sometimes it gets inflamed and then you're hitting it. And if we kept going down this path 5-10 years from now it's going numb all the time.
Yeah.
It used to be intermittent, and now it's just I'm waking up and I'm getting weak. My hands, my muscles are weakening. I feel like I'm dropping things, and then trauma to the elbow. So now we have inflammation, injury.
Yes.
And then even your body's ability to heal things are based on how healthy these nerves are. So if the nerves aren't healthy, then the ability for it to regenerate is going to be affected. So I treat posture. I treat, many doctors treat symptoms, right? And I believe, one, that if your neck, shoulder, hips are in alignment, that the whole spine is going to be aging evenly, and that there's not going to be any one area that's going to be overstressed. And your health will increase when your posture is lined up properly. Injuries and like you were saying, work where I'm holding things on the left side. So yeah, those things amplify postural problems. So we have a postural problem, and then work then ramps it up, and it does. It makes it worse. But we want to first work on a couple things. One, getting your ear over your shoulder, restoring that curve.
Right.
So the first phase of care is what I call the demolition phase. We go through the spine. We identify what parts aren't working, work on them, leave the parts that are loose alone, and then we put you on molding devices that are easy when your neck is curved. You understand? We put you on the device and you feel like it's not doing anything, then we've made it. When you get on and you go, wow, this is uncomfortable, it's because your neck wants to be straight, I want it to be curved, and for it to last till 90, we need it to be lordotic. About an inch forward with your head. What is your work? Are you on your feet all day? What do you...
Mostly on my feet. I'm an event coordinator, so
Okay.
I'm either at the airport or with the event stuff. So I'm also holding the sign a lot of times, and that requires me.
Gotcha, you're fine. Your left shoulder's high. Your head's tilted, but then it makes your shoulders unlevel. Right hip is high. What I'm saying is that it's like the tires in your car. If your tires aren't on your car straight, your tires wear out unevenly.
Correct.
And everybody's blaming the diseased tire, and I go, no, it's the alignment that's causing the tire to wear out unevenly. It's not something wrong with the compound. The discs
the
aren't right. The alignment's causing the stresses. So when, for instance, if I have an injury to the right side of my neck, my head will tilt to the left. It's called antalgia. Anta, away from algia, pain. If I break my right ankle, I'll put weight on my left ankle, right? Your body's going to avoid something that's injured. So your head tilts very subtly, and then if you walk around with your head tilted, it makes you dizzy, so you drop a shoulder. We call it a righting reflex. Your eyes will always seek the horizon. So what I'm seeing, we see it as externally as a shoulder height problem, but it's not really a shoulder height. It's really a head tilt that becomes a shoulder height problem because of that righting reflex. So your body's got to have your eyes on the horizon. If you, anybody at home wants to test this, try walking around for a long time with your eyes tilted. It'll make you dizzy, sick very quickly. Your eyes need to be, your body will do whatever it takes to keep those eyes on the horizon. The good news that the MRI I use to show people is that most of your spine is usually younger. That there's a few parts that are older, but a majority of your spine is actually 20. And if we can mechanically wake those areas up, you'll feel younger. We feel as old as the average age of the parts of your spine that work. So if you only have the older parts working, you're gonna, and every time I move my arm, I'm hurting, because you're just bending where you're injured, where you're worn out, and where the older parts of the hypermobile areas are.
Yeah.
So, is there for instance, when you turn your head to the right or left, is there discomfort or pain right now when you turn?
Tightness.
On the right.
Just tightness, and it's weird because this has just started like a couple weeks ago.
Uh-huh.
The right side, it was never really that tight.
And
it's the same thing, and it's tightness. It's where you can see it like right
muscles
here.
coming out there.
Yeah, it's like it's really tight, and it's like when I do this motion here, it's real tight. You can see that.
Yes, sir.
Right there.
Yes, sir.
But here, it's not that bad. It's still a little tight, but it's.
We'll check that at the end. I like to compare that at the end because your total range of motion comes from every segment working as a team. And what I kind of get the hint of going on is that your lower neck is doing too much, and then that tightness is because you're trying to utilize your lower neck to do all the motion, when in fact your upper neck should be doing something like 60%.
Yeah.
So it's usually a locked atlas axis, the upper cervical, that then causes this extra stress, extra muscle activity in the lower neck in response to a frozen upper neck and your upper back.
Yeah.
So the areas around adjacent are usually the problem. Is there any pain? Show kind of look up for me.
Oh yeah.
Wow, really restricted even looking back. Is there pain when you look up?
Like right here.
Right in the lower neck? Yeah, again,
Yeah, right here.
Again, another evidence. Yeah.
And it hurts also when it's almost the same spot when I put my head down. Now
Yeah, I don't
it's like right here.
Thanks for showing me. I'm just saying, you're way too mobile in your lower neck.
Yeah.
You understand?
Yeah.
See, your whole spine should be working as a team.
Yeah.
But if you're just even when you bring your head back, that was about as far as you go, like there.
Yeah.
Because your lower neck is doing everything and it's saying, I can't give anymore.
That's right.
And the upper neck is supposed to function to give you that full 80 degrees of range of motion, being able to tilt your head back.
Yeah.
So we need to restore the function of your upper neck. Cross your arms for me. All right, bend both the knees for me. All right, we're gonna go pretty deep here. Take a deep breath in for me, a little sit up. Sit up for me. And then head back for me. Let it all go, exhale. Get a deep breath in. I got you, bud. Head back, let it go. Busted your watch.
It's all right.
Oh no.
It's all right.
Sorry.
Put that over there. And then exhale. Yeah, we got work to do in here, bud. Exhale.
Oh, that first one you did was, oh my God, I haven't felt like that in a long time.
We're gonna get some more motion out of there. It's way too tight.
Yeah.
Take a deep breath in for me. It's okay. Exhale. Yeah, we got work to do in there. Okay, other side for me. How'd that feel? You okay?
Pretty good.
Here we go. Exhale. All right, face up for me. Okay, good. All right, face up. There we go. Let's see here. There it is. Wow. And it's huge. All right.
The one on the left, right?
No,
Or
this
the right?
huge knot right here.
Okay.
Yeah, this huge, I mean, it's almost non-existent over here. And you have, I usually name these. I mean, it's a huge Frankenstein bolt on the right side of your neck. And it's in avoidance of this that makes it grow larger. It's like a problem in life. The more you try to ignore a problem, the larger
It's weird because
becomes.
I've always thought it was on the other side, not the right.
Left's abused. Absolutely. The
I see.
symptoms are going to be on the left, but the
I see.
source, if you injure your right ankle and then you put all your weight in your left ankle, now your left ankle is going to hurt because it's doing double the work, right? And then so everybody comes in with a busted left ankle, and I'm going, well, that's because you're avoiding the right ankle. The only reason the left side hurts is because you're tasking it to do more than what it was meant to handle. All right, so we go easy here. I got you, bud. I know. Okay, we'll go deeper in a second. I want to be careful to not move what's injured, and I'm just trying to move what's tight.
Mm-hmm.
What's tight is reluctant to work, especially without the lower neck moving. So I'm just trying to isolate the upper neck here a little bit. Here we go. Okay, we'll go deeper into yeah, right there. That's your problem.
Yeah. Oh my God. I feel
It's
it.
huge. It's like a huge Frankenstein bolt. And it's caused you can't, your head won't tilt to the right. No wonder you can't lift your right arm up. Your head won't, it doesn't tilt. And we have to, unlock. They're just joints. It's like if I asked you to bend your finger and you only could bend your finger halfway. It's like it's your range of motion here is, massively reduced. And now because this area is underworking, another vertebrae has to then make up for that. And that's when you showed me earlier trying to look up. You're doing most of that with your lower neck, and your lower neck is exhausted and overwhelmed. And we're going to wake up the upper neck. That's all it is. Right here. There's your problem. There we go. There you go. There it is. You didn't even know this was here, did you?
No.
Yeah.
No.
We don't feel or connect with the parts of our spine that don't work. Right? The employees that never show up to the factory you don't even know exist. Right? Who are you? Do you work here? Yeah, I work here. I get a paycheck. I've never seen you around here.
Yeah.
You've never seen this vertebrae. You don't.
No, I've never thought there's been an issue on this side at all.
Right.
I've always thought it's on the left.
That's the abused. Yeah, I know. So when we're stretching later, there's a piece of foam called a Denerol, and it emulates my hand. It holds your neck in this curved position. And what we're going to do is we're going to have your head back on it like this, and we're going to do a little bit of right rotation. Both sides are responsible, but that nugget's huge on that right side.
Yeah.
It's not nearly as big on this side. I mean, it's there, but it's half the size that the right has. Okay. All right. Oh. Yeah. Paul, this is the when you lift your arm up, this first rib here rises up. That's what I meant by tilting your head and raising your arm. And it compresses what we call the thoracic outlet, which is this funnel here that all the nerves from your lower neck travel through to get down into your arm. So mechanically, kind of the same thing when you tilt your head or lift your arm. It compresses this channel right here. It's okay. Relax here. Relax right there. Let it go. There it is. Nice. Yeah. Relax. There it is. Good. Yeah. It was designed from protection. When you look at that model, like the first thing that it kind of screams to me is that it was very important to protect the spinal cord, right? You have all these bone, you understand, and joints encapsulating the spinal cord. So it was important that the spinal cord is protected. But then obviously the wires that are in the spinal cord need a way to get out. Right? You can't have it totally like a sealed up jail. There has to be exits somewhere.
True.
And so the second thing that was important was range of motion. So you could fuse everything. Do you understand? Have no range of motion, meaning those holes couldn't change in size, but now you can't turn your neck, you can't tilt your body, you can't lean down to tie your shoes. Right? We could lock everything down, but it was like two things were important when the spine was designed: protection of the spinal cord and range of motion. Right? But those two things are kind of at odds with each other. There are other vertebrates on this planet that have more stable spines, but their range of motion is a lot less. Does that make sense?
I see.
Like a ram. Think of that animal that shoves its head into another animal.
Right,
you understand?
right.
Its range of motion is very low. relative to ours, right? It can't
Right.
turn its neck like us, and
Mm-hmm.
and so it leads me to say the statement that we're not designed to play football. Because if
Right.
we were designed to play football, the anatomy of our spine would emulate that of a ram's,
Correct.
right? We would have locking vertebrae in a different way that could handle compressive forces in that kind of manner.
True.
Our spine, to me, it was designed for mobility. We were designed to be able to move. I mean, 160 degrees of cervical rotation, for example. That's the spec rating.
Yes.
80 degrees left, 80 degrees right. You should have 160 degrees of cervical rotational range of motion. That's a lot.
Yes.
It's a lot of. I mean, not like an owl, I guess. I mean, owls have.
They
But then
can-
owls' stability is a lot less. You understand?
Right.
They can't. Their protection of their spinal cord is a lot less.
Because of their flexibility.
Because of their flexibility so high.
Yes.
So there's like concessions that you have to make. Do you want range of motion, or do you want protection?
Mhm.
And obviously, the ribs are specifically designed to protect your heart and lungs and to protect your organs, and so that limits mobility, though, right?
Right.
Because we have to have this cage that shields us. And so what happens is the areas right above the cage and right
Mhm.
below the cage are
Mhm.
more prone to being abused,
I see.
right? Because the cage protects
Protects. Yes.
protects that area. So you don't hear of T5 disc injury. You don't hear of T10 disc injury because those areas are all guarded.
Yes.
But you hear it happening right at the lumbar 5 and cervical 7. The areas right above or below the cage
That's where.
get destroyed.
Mhm.
And so the take home that I've 16 years of doing this is that you have to keep that thoracic cage mobile. It has a high tendency to want to lock down,
Mhm.
and then the destruction of the adjacent areas is going to happen inevitably if we don't, keep that range of motion in the upper neck, the upper back. Okay. If you want a quiet visit, it costs double. It's discounted if you let me talk, and it'd be so much more ASMR and calming if you just shut your mouth. He wanted the discount. So fine, you can talk all you want. It's also what the word doctor means. It means teacher.
Right.
To learn something. How am I supposed to be telepathic?
I appreciate the education. It's like, I feel like that's a role of a doctor. It's not to just treat the issue, but to
Teach
you. Yeah, teach
Help
me
me
how
understand.
to
Take care of myself.
prevent it.
That's right. Amen. I'm just real quick. It's coming out. Yeah, that's a lot right there. Wow.
Don't be surprised.
Yeah, it's a lot.
That left side is just a mess.
Well, the nerves are having to travel through this area. It's like the nerves are sitting in acidity,
Mhm.
which we call sensitizes the nerve, meaning it moves closer to its action potential or its firing point. My wife would be pregnant, and I'd walk in the house, and she'd go, "You haven't done anything wrong, but you came in here and I'm immediately upset. I just don't even want to see you right now." Right? That's a nerve when it's sitting in acidity. Right? You didn't even really do anything. It just pissed off with your presence. So by working on the area, massaging, postural work seals it, but we're trying to desensitize the spine, make it harder for these nerves to be so, trigger point, or so trigger finger, right? Ready to itchy finger, just ready to go off any second.
Is it like a speed bump right here?
Yes, sir. Yeah, you have an injury. I can even see it. I mean, it's huge. Yeah, it's all right here.
Right, yeah, you can see it.
Yeah.
But when you were laying down, this whole left side's elevated a good
Yeah.
half inch.
It's popped up.
Popped up, yep. But yeah, oh my goodness, yeah, this left side is. Yeah. There we go.
Here's something had to happen to my lower back too, like especially on the left side.
Yes.
Because a few years ago I started to get this tingling sensation,
Yes.
especially around here.
Yes.
And it will be more irritated when I sit down. Like when I stand up, it will feel better.
Yes.
And if I sit down for like an hour or two,
Yes.
that will really irritate it.
Yeah, there's a disc injury in there too. There's disc injury in there, meaning the nerve is close to its threshold. The muscles are getting tight to protect, so they try to come to the aid of the deeper structures that are injured. But it's mechanically, because it's tilted, because this is too tight up here, your lower back is taking the brunt of the mechanical stresses. The problems are up here, right there is more specifically where it's coming from.
Yeah.
So for every really, really overworked area, for every really, really overworked and hypermobile area, there has to be a really, really stiff, tight, underworked area, right?
Mm.
Like there's the opposite.
Is
Where's
it the opposite side of it on the back or in the front?
Well, it's usually higher, what I'm trying to say. Usually there's up here
Oh, yeah.
that then causes this to be abused.
Right.
So this is frozen, and then the lower back is simply compensating.
Mm.
But right here is where I find the
Oh my God, yes. This is like that part of my spine feels. I've always had an issue with it. And I don't know, like probably herniated or something. Right
Well, it's-
there, right
the-
there where your elbow.
Yes, sir.
Oh my God.
This is where all the original injuries happen. Yep. When you were the youngest, your youngest injuries happened here because mechanically this is the first part of your back that's supposed to work. It got injured, it quit, and you've been running everything with your lower back.
You're right.
Mm-hmm.
You're right. This has to go back to like 2003 or 4.
Right. You got it. You got it. Back when you're 20. Yep, sure.
Mhm.
Yep.
I did have issue in that area,
Mm-hmm.
right there where your elbow is, and it's kind of like you said, it's just. I don't know if it got better, but it's just didn't bother me.
Right. Well, then it was injured, it bothered you, and then it just froze up.
Right.
And then you forgot about it.
Right.
And now we're dealing with the effects of losing your main engine. This is your main.
Mm-hmm.
When you're pointing down here, this is like your backup engine, your secondary
I
engine,
see.
and you're now using your secondary engine to run the entire show with it.
Right.
And everybody's going to try to treat your backup engine and go, well, yeah, let's try to operate on it and do something. I'm like, how about we get the main engine up here running? And if we get the main engine running, the backup engine's going to be on vacation,
Yeah.
and you're going to be just fine. All right, come on. Yeah, right there, yeah.
There's not dogs and cats in that area. That has been my problem area for years. And now it's like, I don't know where it's going, but it's
Right.
traveling to that
Right.
to that left side of my
Right.
body, and
Yeah.
it's honestly making it very
Yeah.
difficult to exercise. I can't even work out like normal anymore. The other day I did some pull-ups and some push-ups, and that area is on fire. It's on
Mhm.
fire.
Just highly sensitized. You got the
Yeah.
tissue all inflamed.
Yeah, it's on fire.
So that's what we'll see in a minute when I gua sha it. You're going to see all this acidity.
hmm
So when you make muscles guard an area, the
Mhm.
muscles build up lactic acid, right?
Right.
Lactic acid is cellular exhaust. It's what you feel when you're doing a bicep curl and your muscles are to, burn. But these are postural muscles. Do you understand?
Mhm.
So because the posture's not correct and because you have injuries inside, you have muscles never getting a break, right? Unlike your bicep where you just work it out at times, these muscles don't ever get vacation. They're just,
because they have to support.
they have to support it all. And
Makes sense.
there are a lot of practitioners that are teaching a narrative that that's their job somehow, that it's the job of your muscles to give stability. I'm not disagreeing with the fact that they can give stability, but to say that your muscles should simply be tight and contracted to give stability to your spine all the time is nonsense. Your alignment should give stability. Your
True.
posture,
True.
the mobility of your spine working as a team gives stability. If you have half your spine not working, then the areas that are working are going to be destabilized because they're doing more than what they're supposed to be handling. So alignment and mobility are the pieces of the spine of how it's maintain its health, and
I agree.
not, just muscle strength. So what I'm saying is now because you have all this acidity in the muscles, you then feel that as burning.
Yeah,
It's going to burn
because
all the time.
These muscles have been working non-stop to maintain the posture, which is unaligned.
Right.
Like you said.
Right. there. The spine should be what we call autonomous. Auto means self, nomi means law. Self-ruling, self-governing. It shouldn't need even me. Shouldn't need drugs. Shouldn't need chiropractic. You understand?
Right.
Your body's supposed to be autonomous. Now, injuries in life and getting stabbed or shot, things happen where you now need. But my point is that you're supposed to be autonomous. It's supposed to be self-running, self-governing.
This is still.
But now we have injuries and things have happened. Autonomy is shutting down, and so now we need help to restore the autonomy. Is the goal of the care.
Oh my God. Oh. There's something over there. Feel that popping? What is that? These are knots or?
Right, so the posture's not correct, and so the muscles are contracted all the time.
Oh my God, right there.
And where the most internal blockage is, the mark will come out darker.
Mm-hmm.
You know, the antagonist to this will say you're just busting blood vessels, but why then do the marks only really come out in certain areas? The areas that are the most congested inside and the most blocked inside is where the most, the darkest mark will be. See, the areas that are abused are actually getting plenty of blood flow. They're actually circulating, right? They're
Right.
abused. It's the areas that are frozen
Mm.
that are congested, where they're not getting oxygen to bind to lactic acid and form carbon dioxide in water. So the tight areas are where it's all trapped.
Oh, yes, that right there. Oh my God. I know this is gonna.
Mm-hmm.
I think I'd be losing that spot too with the lacrosse ball.
Mm-hmm. Part of this is going to be getting your shoulders back. When we're stretching in a minute, I believe a lot of the constant stress here is because your shoulders are rounded forward. So as we work on your back in a minute, I'm going to show you how to bring your shoulders back, and that'll decrease the amount of continual work that this area is under. The more rounded forward our shoulders, based on also the position you were showing me when you were working, that rounds our shoulders forward, and that puts like a tug of war battle that this muscle's playing against the pec.
Right.
And then these muscles lose the war. They get pulled in the mud. They complain. They're losing the tug of war with the pec. And we're going to help them win a little bit by bringing the shoulder back. Yeah, there's a lot in there. All these marks are what he's trying to use the lacrosse ball to like shine a spotlight on. You're trying to shine a spotlight on the internal blockage that's in here, or even just the continual stress that the posture is putting on this area. And so, the root cause is the alignment. The alignment creates the stress along with injury. And if we can deal with those things, you won't feel this constant need to put a lacrosse ball here. It shouldn't be the long-term care of this. It should be, let's get the alignment better. Once it becomes full-blown, like your hand's numb and you have shooting pain down your arms, then all of a sudden everybody agrees with me. But it's like, no, 5-10 years before that, when he was just having weakness, and that was early signs of it. You understand?
Right. Oh my God. Right there. That elbow never been the same ever since that accident.
Yes, sir. Yeah.
Like if I straighten it out and I rotate my wrist, it will pop.
Scar tissue.
Yeah, after that bicycle accident, I couldn't straighten it 100%. Like it was going to 80 maybe.
Sure.
So like there was a big nerve in the back that I was
catching.
Yeah.
Right back here is where the groove that the ulna has to be able to pivot back into to allow you to be able to straighten. The humerus here and the ulna, this kind of, if there's fluid back here, you understand?
Yeah.
This can't go into that. So when you damage this, all this fluid builds up right in this little pocket.
Right there. Oh my God.
And so if your range of motion is decreased, it's usually because this won't. This has been occupied with fluid that now the bone can't go into. Right there. When you have a trauma like that, your body expects you to do it again. You understand? It puts down walls and stiffness in anticipation of you falling off a bicycle again. Well, I'm not going to do it again, Ed. Yeah, but your body doesn't believe you.
True.
Your body believes that this is the new normal, is to fall off a bicycle and land on this and bust up your elbow. And so it's, why haven't I got my range of motion back? Because again, your body's going to reduce range of motion to increase stability. It's going to try to, make it stronger and stiffer. And so kind of the treatment is to try to talk to the body and say, hey, stop putting up these barricades, take them down. We got to unring the bell and go back to the way it was before he fell. And all right, but the body's not going to do that kind of willingly. It has to, kicking and screaming. We're going this way. Oh, that was it. Wow, that hasn't moved. is just a mess.
Mm-hmm.
So it's congestion. These are like clogged pipes, but
Yes.
no wonder you're hurting.
Yeah.
We gotta flush all this out. I'm gonna teach you try in a minute, try to do things at home to try to push some blood in there yourself.
Yes.
And then yes, to some degree you have to have care. There we go. A little bit. Ooh, yeah. Nice. Yeah, nice. Kind of look up for me a little bit, and then press back with your elbow here. There you go. There we go. Here we go, press. Keep pressing. Oh, it's okay. You good. I got you. Tilt left for me a little bit. There we go. Tilt it left. Okay. Didn't know I was signing up for this, but it's part of the package. Here we go. Tilt your head to the right for me. And tilt right. Okay, it's okay. All right. I got you. So this is called a cervical dental, and the goal of this is to mold.
Mm-hmm.
I was saying earlier about it emulating my thumb. It holds you in this curved position.
Mm-hmm.
And like I said earlier, we're going to do a little bit of right rotation. That makes sense? To get some more pressure on that right side. Sometimes you'll take your hand, you put it on your forehead, and you press.
Mm-hmm.
Does that make sense? Try to see if you get your head to sink in, and then you put your hand back down and relax and try to take a nap. We need to start balancing and bringing some extension into your life, but not by making your lower neck do it. That makes sense. We want your upper neck to do it. And that's the first goal of treatment, at the very least for the table, is why the table is necessary, is so that when we do this, we're not just making the lower neck do it, but the whole spine is working as a team.
This is not even
Correct.
touching the.
There's your problem.
This is so tight right here.
We got to stretch your shoulders back. You understand?
Mhm.
You got work to do. It's 20 minutes. You got to hold, and then you're going to work all these angles. So this is like 9 and 3 on the clock. You understand?
Yeah, man.
All these angles. You got to work on every. I want all this mastered. You
Right.
understand? You want to go to the edge and back off. You understand? The goal is it won't change, kind of like the gym. You understand?
Mm-hmm.
You're not going to see improvement in muscle mass if you don't push the muscle and tear it up a little bit, right?
Mm.
You have to push it to get it to change. So you want to go to that edge of not overwhelming yourself, but and if it gets too difficult, you put your hands in your belly, take a break. Good, I know. I'm greedy. All right, good. Sit. Oh, yes. There you go. Let it go, chin up. Good.
Oh.
All right. You did great.
Good.
Yeah.
Yes, I feel good now.
I'm going to check that range of motion one more time. I just want to see how you're. So just kind of look gently up for me again. Wow. Whoa. Yeah.
Oh, it doesn't. I don't have that pain anymore.
Isn't that cool?
Yes.
Isn't that cool?
Yes.
Right, because your whole spine's working as a team, right?
Yes.
I just got your upper neck working,
Yes.
and you're going to maintain it with that dental. And
Right.
then that's going to be the rest of your life, understanding to not make your lower neck do all the work.
Yes. Thank you so much.
You're a
Dr.
good
Ed.
friend. Yeah, very
Thank
good.
you.
Thank you. Appreciate it.
Thank you.
Did great.
Thank you.